Bismillahirrahmanirrahim. Today our topic is wound. A wound refers to a physical injury that causes damage to the body's tissues, typically involving a break in the skin. Wounds can vary in severity and can result from various causes such as accidents, cuts, burns, or punctures. Here is some information about types of wounds, signs and symptoms, and first aid treatments. Types of wounds. Incised wounds. These wounds have clean, straight edges caused by a sharp instrument, object like a knife or a glass shard. Lacerations. Lacerations are jagged, irregular wounds caused by a tearing of crushing force such as a fall or an accident. Puncture wounds. These wounds occur when a pointed object such as nail or needle pierces the skin and deeper tissues. Abrasions. Abrasions are superficial wounds caused by the scraping or rubbing of the skin against a rough surface resulting in a graze or scrape. Avulsion. Avulsions is involved the tearing away of a portion of the skin and underlying tissue. Gunshot wounds. Gunshot wounds are caused by bullets or other projectiles and can result in significant damage to the tissue. Signs and symptoms of wounds. Bleeding. Depending on the severity of the wound, bleeding can range from minor to severe and may be accompanied by spurting blood or a steady flow. Pain. Wounds often cause localized pain or discomfort which can vary depending on the depth and location of the injury. Swelling. Inflammation and swelling may occur around the wound site. Redness and warmth. The skin around the wound may appear red and feel warm to the touch due to increased blood flow. Discharge. Wounds may produce pus or other types of discharge indicating infection. Impaired function. Depending on the location and severity, wounds may impair movement or normal bodily function. First aid treatment for wounds. Ensure safety. Prioritize safety and remove yourself and the injured person from any ongoing danger. Apply pressure. If there is a bleeding, apply direct pressure to the wound using a clean cloth or sterile dressing to help control the bleeding. Clean the wound. Rinse the wound gently with clean water to remove any dirt or debris. Avoid using soap directly in the wound as it may cause further irritation. Apply an antiseptic. If available, apply an antiseptic. Solutions are ointment to the wound to help prevent infection. Cover the wound. Use sterile gauze or a clean cloth to cover the wound and secure it in place with a bandage or adhesive tape. Seek medical attention. Depending on the severity of the wound, it may be necessary to seek medical help, especially for deep, large or heavily bleeding wounds or if signs of infection develop. Remember, these guidelines are not a substitute for professional medical advice. It's important to consult with a healthcare professional for proper evaluation and treatment of wounds.